I'd like to call the General Services Committee together. I will make a motion to approve the September 16th committee minutes if there are no amendments. Could I have a second? Thank you. At this time, we're going to have a presentation from Jonathan Rose about New York State Codes updates.
Hello. First of all, being this is the first time I've addressed you as a committee, I'd like to thank you for giving me the opportunity to lead our office forward. This presentation is, it's not just for the code cycle changes, we're going to touch on that, but it's just a general update on our office because have been silent basically since I took over in July. So first to start off with, I just want to give you the numbers for from July through September 30th. Zoning permits issued, we issued 94 of them. Building permits issued, we issued 244. 11 of those were demolition permits, so not new structures, but structures coming down. We issued a couple operating permits, which are just for tents and other activities when they gather. Total fees collected through our office for that 3 months was $54,940. And the construction, the estimated valuation, and this is taken right from the permit applications, would be a total of $16,671,744,000. So $744. So, and if any of you would prefer to get like monthly permit cycle, I calculate it all anyways, but what I can do is share them through email. They'll probably just do it to the entire group. And if that's the case, they won't be broken down by district, obviously, but by municipality, that you can keep an eye on things that way. So I can do that. A couple of categories I want to touch on. So I'll start out with staffing. We're holding our ground, maybe. The main thing, and again, we're all aware, so this isn't a complaint, but just an update. We're holding our ground. But what we're really not able to do at all is advance in areas that we need to, right? So our office is mainly reactive, right? Someone calls, they need a permit or they have questions, whatever, we react to that. However, we could be a fair amount more proactive if we could ever get back above water and set some policy changes. One of the things we've done recently, just as of last week, is we've taken the step to go by appointment only, so that's one of the ways we can be more proactive, because it tends to be that every time we kind of get in a flow, we have someone come in and we get disrupted, sidetracked. And some of that's understandable. We want to serve the public, but that's one of the ways. But there's other ways I think we can be more proactive, but it's going to take some time getting there. So staffing wise, we all know where we're at. We have a vacancy to fill. We're working through that process now, just starting to review and set up a couple of interviews. So anyone we hire will be 6 to 9 months probably before they're certified. So they'll be in a limited role. It'll be a good time for them to learn how to navigate our systems and how to get the proper order of things. So it'll be a productive time, but hopefully we can get that addressed over the next month or two. Personnel wise, you all know we went away from doing the county by set municipalities, and we've went more to where each officer has somewhat of a specific role that they focus on. Now, again, we all adapt and we do what needs to be done at any given phone call or time, but we have it so now each officer does have one kind of role to spearhead, and that's working. It's going to need to be adjusted, and we're going to see what whatever new personnel we add, what their strengths are, and we'll adjust things as we go. But that's just kind of by way of an update. And then, of course, I put a couple things in here. I concerning trends, I guess, is what I called them. But overall property maintenance is concerning. Well, as we look around the county, and we've had these discussions, we know that property maintenance is continuing to go down. And I think that it's important that, property maintenance isn't about, the county being able to go out and raise your taxes. And that's kind of the public perception, is that we want you to fix up your property so we can charge more taxes. But just like a vehicle or anything that you own, if you don't spend the $150 to change your oil today, then next year you're going to be replacing an engine for $6,000. And that's really the mindset that I think we need to help the public to understand, is this isn't about taxes. This is about buildings becoming bad and costing everyone a lot more money in the long run to try to remove or repair once they're beyond a certain point. So just overall property maintenance is concerning, and I know that we're all working on that, but that's something we need to continue to discuss. And how do we, I want to use the word incentivize. How do we incentivize property owners to stay on top of this rather than feeling like they're being penalized when they make changes? So that's something I wanted to raise. And within the property maintenance, the thing that's probably the most alarming is there's been an increase in rat infestations over the last couple of years, especially this summer. We've had, so right now I put down that we have 4 cases currently open. That's very misleading. Basically a case would be like the village of Lowville, because we've got a numerous calls on one area of Lowville. And we consider that one case, even though we've gotten a lot of calls and pictures and footage of things that we're attributing all to one case. But that's numerous calls, numerous complaints, can you come out and look at it? These are very time consuming, and it's something that it's hard to eradicate. It's hard to really prove that they're gone or dealt with. So I just want to put that out there by way of even public health risk. I think one of the things that we're seeing as a common factor in these is bird feeders. Obviously we can't tell our people, no bird feeders, but maybe we need to consider just some public informational stuff to put out there about some of these issues we're seeing and what's contributing to it. So since COVID, we see more and more people with, say, chickens at home or whatever. And so they're storing feed. Even within the villages, there's feed stores, there's bird feeders. These are all the types of places that we're getting footage of, rats around a bird feeder. So just putting that out there. I don't know if this is the place, but I think it is. So something that we're concerned with as an office. And then the other, increased building without permits. It's just something that we're not really sure how to combat. We're just seeing more and more of it, and we're going to get into next the code changes coming up, which in my opinion is going to contribute to this building without permits and fuel more and more animosity between, our general public and, the state or our office or whatever, which obviously is not the case, but that's kind of the way it's perceived, is that, we make life hard, so we're just going to build without a permit. And so it's something that I think is worth addressing. We're open to any kind of input or anything we can do to try to curb this, but that leads us into the changes within the 2026 code, which I know you guys have been addressing or discussing. So we did a podcast a couple days ago. It was released a couple days ago, Ben and I, and we just touched on a couple of the high points, but the 2 main ones that I think a lot of the public is hearing about is the no fossil fuels in new buildings in New York State going forward in 2026. So we call it the non-electric or the all-electric, but probably the best way to view that is it's no fossil fuels. So no more propane, natural gas, fuel oil, for whether it's for heating, cooking, lighting, anything. And that's in new buildings only, all new buildings, completely new buildings, if I can say that correctly. So if you were to renovate an existing structure or put an addition on an existing structure, that doesn't come into play. So that would be the upside of this, is I think it's a good time to see maybe some reinvestment in some existing buildings. Maybe we will see again an uptick in just fixing up some of the blight. So that's a positive that could come out of this. But the no fossil fuel mandate, that's going to be a tough one for us, and for you folks who are probably going to get a lot of feedback. There is some opportunity. I think that I have to be careful. I've had a lot of communication with the state and some public officials, but I have to be careful not to give the impression that I'm fighting back against my authority, who is New York State Department of State. However, you folks are in a position where I think there's a lot of outreach that can be done. There's some bills being put together. You know, whether they ever make it to a vote, I don't know, but there's some opportunities for maybe counties to consider opting out and some of that. I got some information to pass along to you to follow up on, but as it is now, this is 100% across the board. Anything we're going to see in Lewis County, other than a hospital or a factory, is going to be required to be no fossil fuels, residential, commercial, either one. And then, of course, snow loads have changed the calculation of snow loads so that it effectively puts Lewis County as a whole. And of course, the snow loads will vary, but as a whole, the entire county is going to be in a classification that we as code officers can no longer help people. I don't want to use the term design because I say over and over, we're not designers. But if someone comes to us and says, I want to build this structure and I want to use 2x10 rafters, 16-inch on center, does that work on this span? We're not going to be able to give them an answer. New York State has taken it completely out of our hands. And to simplify it the best that I can, the highest that we can help someone, the highest that we can approve, whether it's header calculations, jack studs, foundations, rafters, the highest the code book allows us as officers to go is 70-pound snow loads. There won't be a property in Lewis County anymore that's 70-pound, and there'll be some that are in the upper 120s, 130s, and higher. This is a national, this is not New York State calculating this. This is international ICC code. I don't know if it's the Army Corps of Engineers or who actually does this, but it's ICC, it's international, adopted by New York State. So it's not just New York State alone, and I think it's a lot of this just comes from insurance companies. Same with the other things that we see. It's hard to combat, right? You're not gonna fight the insurance companies and win. It's not our goal to fight anybody and win, but our goal is that when people come into our office, how can we give them a path forward without requiring a stamped engineered drawing on every building that's built? And that's what we're up against. The main question we're asked, why can't we just use some common sense and meet in the middle? We can, but not legally. And if a building fails, it's on our office and on the county because we've approved it when we have no authority to approve it. So we'd rather not venture down that road. So I'm just putting this all out there as these are things that we've really got to think hard about. January 1st is coming quick, and we're basically going to be left in a place where we have to require engineered designs on almost everything that's built, including, you know, as small as these 12 by 12 sheds in your backyard and up. Anything that requires a permit, 144 square feet or greater. So that was all I had. I know you guys probably have some questions. I've went over my time. In conclusion, I just want to say that our office is open to any guidance, advice, encouragement, or just a quick visit. I do appreciate a lot of you folks stop in our office when you're in and out of the building and check in. We appreciate that. And for anyone that's going to be listening to this out in the public, our goal is to be a partner with the homeowners, the contractors, and the investors in Lewis County. Our office does not want to be heavy-handed. I think we do a very good job of not doing that, and yet we've got to balance the law in the codes. I don't like to use the term law, but the codes, which are law, and that reality that if your building fails down the road, you're going to be in a battle with an insurance company on whether or not you're going to get coverage. So we're doing our job the best we can. We like to work together with respectful communication. I feel like we can accomplish the tasks ahead, but we've definitely got some things to look at. Okay. So that's my presentation. Do you have any questions for me or any advice for how I can get you better reporting or anything like that? Just let me know.
I have a couple questions, John. So the fossil fuel law, does that include wood heat in new builds? Could they do an outdoor boiler or wood stove?
They can. Wood heat is still allowed. So fossil fuel by definition in the code would be anything petroleum based or coal, natural gas. So wood heat is still allowed. That's a question we get asked a lot. But again, and then you could do a backup electric supply. which is reasonable, but a lot of people just don't want to deal with wood for obvious reasons, but those who want to still can. So that's definitely a
So a
plus.
pellet stove would fall under
A
that as
pellet
well?
stove, yep, any form of wood, even corn, potentially someone,
Mhm.
but just not coal or
So-
fossil fuel.
The second part is with the new codes for structure and snow load driven most likely by insurance companies. So would that in turn lower insurance costs and premiums over time?
I can't answer that, but
I,
I think,
wishful thinking.
right.
Uh, Thanks, John.
But, and that's why I reiterate that we've gotten kind of, even our office has gotten into the habit of saying this all electric. I'd like to rephrase that to no fossil fuels, because there are other options. It's not all electric. It's just no fossil fuels, which is pretty broad, but that's what it is. So other combinations, obviously geothermal is considered electric. There's other ways. It's not just plugging into the grid, but it's no fossil fuel in any way, shape, or form, other than your emergency standby generator is allowed to be. So any other questions?
John, with various towns and municipalities doing revals, have the assessors come to your office and include you in that? They've found a lot of the homes that have been remodeled or new builds that have not acquired the proper permits?
We do get some feedback from them on structures. And just to be clear, remodels are common, but new homes being built, there's not many of those happening, although there have been a couple. But really, it's the smaller structures. It's the adding of a deck, adding of a porch, building on or remodeling with no permits. Every day that we're on the road, we just we see numerous, and we can't even follow up on all of them. I'm being honest about it. And that's the problem. And once we start backpedaling, then everybody knows that. And that's why I say, I feel like we've got to have a way. We do send out as many letters as we can, and most of the people respond, but by then we're behind the game anyway, so that by the time we get a permit, we can't do proper inspections anyways. So it's just tough. And I say that, but we have so many people that just come. I mean, overall, I just love dealing with the public. We have so many people that just come and they say, tell us what we need to do. Tell us what the steps are. That's the norm. It's a smaller percentage that doesn't do that, but they take up most of our time, because then you're in the chasing mode with no real way to ever make proper amends. And so I don't want this to sound negative, because so many of our people they just want to know what they need to do it correctly and have the proper certificates. So
I am going to add that the short-term registry law that New York State passed is going to require code inspection prior to doing an Airbnb. And that's going to come online in the next 30 days. And John's office is going to have to go out and inspect every Airbnb. So it's going to add a significant workload
Yeah.
as well.
thank you. Okay, that's it. Thank you.
Thank you, John. Okay, we're ready for draft resolutions, please.
Okay, the first one is authorizing a renewal agreement with Train Building Services to provide heating, ventilating, and air conditioning maintenance services for the DMV Board of Elections building for the period of January 1st, 2026 through December 31st, 2028 at the following respective amounts. 2026 is $13,320. 2027 is $14,023.20. And 28 is $14,768.59.
Any discussion? All in favor, say aye. Any opposed? Carried.
Approving a budget transfer in the amount of $50,000 in the district attorney account lines for additional professional services costs.
Any discussions? All in favor, say aye. Any opposed? Carried.
approving a budget transfer in the amount of $39,640 in the highway account lines for increased cost of bridge materials.
Any discussion?
I have a question on that. Is that for any of the bridges that were damaged during the flood last year? Or is this just from,
Yeah, this is
Increased
just
cost.
general bridge work that he's
Okay.
done this summer.
All in favor, say aye. Any opposed? Carried.
Authorizing a lease agreement with Bonnie Hodkinson for the purpose of using the premises identified as tax map number 171.04-03-11.1 as recreational public parking to commence upon execution of the agreement and continue for 99 years.
Any discussion?
Is there revenue from this?
They're donating the use of their land.
Yeah, no charging.
All in favor, say aye.
I,
Any opposed? Carried.
And the last one is approving and authorizing the Director of Recreation, Forestry, and Parks to enter into land access lease agreements with landowners in order to establish parking lots for access and use by recreation users in Lewis County.
Any discussion? All in favor, say aye. Anybody opposed? Carried. At this time, we have no motions and no executive session. Please review your monthly department reports. I'm looking for an adjournment. Thank you. In a second. Thank you. We are adjourned.
I'm going to bring the Human Services Committee to order. I will start by making a motion to approve the minutes from September 16th. If no amendments, do I have a second? Tom, any discussion? All in favor, say aye. Any opposed? Okay, motion carried. And I am going to invite Ashley Waite, Director of Public Health, up forward to make a presentation.
All right, good afternoon, everybody. Today I am going to present to you the Lewis County Health Assessment. So first thing, what is a community health assessment? So it's a requirement of local health departments, used to be every 3 years, is now every 6 years. And it's an assessment of our current health outcomes, health behaviors, demographic data, services that are available in our community, and the environment. And what do we do with this assessment? We inform our community health improvement plan. So based on the data that's in the assessment, we develop a plan to improve the highest priority health outcomes, health behaviors. We also use it to inform our other Article 6 public health activities. We provide the data to multiple community-based organizations to utilize in their own planning activities. And it's also a useful tool in grant applications to prove a need for something. So the data comes from a lot of different resources. There's a variety of data dashboards, vital records, medical records, insurance claims, surveys, the U.S. Census Bureau. JCC Center for Community Studies also does a community health survey for us on an annual basis. They've been doing this for 10 years now. And the Fort Drum Regional Health Planning Organization, who helps put our community health assessment together, also does key informant interviews. So that's sitting down with small groups of individuals to gain more qualitative rather than quantitative data. So the New York State Prevention Agenda is the framework that we have to follow when we're putting together both the health assessment and the health improvement plan. This framework was started in 2008. Like I said earlier, the cycle has changed for local health departments from a 3-year cycle to a 6-year cycle. And the focus has changed in 2025. The focus was really more on health outcomes, and it switched to social determinants of health. So you'll see the old domains there on the left and the new domains on the right. So why the switch to social determinants of health? This is really changing the focus to the root cause of the poor health outcomes or positive health outcomes. So our finances, relationships, housing, transportation, education, access to care, and environment all play into how healthy an individual is. So to truly affect somebody's health, we need to focus on those things. So for the last 3 years, we've been focusing on both adult and childhood obesity, suicide, binge drinking, smoking, and falls resulting in hospitalization. And just to note, we've been working on obesity and suicide since 2014. I'm sure you guys will understand this, but it takes a long time to have any kind of impact on health outcomes. So I'm just going to go over very briefly where those current priorities sit with our latest data. Adult obesity has continued to rise. Childhood obesity has also continued to rise. Suicides have declined a little bit, but we're still 3 times the state rate and goal for the prevention agenda. Our binge drinking, surprisingly, because this is in 2021, kind of during the pandemic, our binge drinking dropped, which is a good thing. And the health survey that is done year over year also reported individuals that responded reported less binge drinking in that as well. Smoking rates have continued to rise, unfortunately. And there will be more data later in the presentation to talk about exactly what products we're using here in Lewis County in comparison with the rest of the region. And our hospitalizations due to falls has stabilized. So the next few, well, quite a few slides are focusing, like I said, more on the social determinants of health and the data around that. So I don't necessarily have trend line data for you like I did in those other slides. It's organized like this. The green arrow suggests that we're doing well. A red arrow suggests that we are not meeting the New York State goal for that. And I know it's a lot of information on here, but every slide that I go through, I am going to give you an overview of what's important. So we are actually meeting the poverty, unemployment, and nutrition security objectives set by the state. So we're doing well there. The bottom line under housing and affordability, we have very small numbers in Lewis County, which makes this data not stable for us. Hence the reason there's an NA there. I don't know about you, but the fact that we're meeting the poverty objective set by the state surprised me. So upon further investigation, our poverty rate has dropped here in Lewis County. However, when we look at poverty in individuals aged 65 and older, it is on the rise. Our population 65 and older is also on the rise. So in the community health assessment or health survey, the Lewis County respondents, 16.1% of them reported housing insecurity. So that's quite a bit higher than those in Jefferson and St. Lawrence County. As far as education access and quality goes, we're doing very well with high school completion and low absentee levels, but poor with continued education at the college level. And this is just reflecting we're doing better than New York State with high school completion, but we're about half of what the state is as far as college educated individuals. With healthcare access, we have low first trimester care for pregnant women. However, we also have low mortality rates for both women and infants, which is a good thing. We have a low level of proper hypertension management, and we have a low number of Medicaid enrollees going to the dentist every year. the community health survey asked individuals what kinds of chronic health conditions that they have. And you can see Lewis County has very high numbers of individuals reporting hypertension, higher than the rest of the region. And the box on the right there, Lewis County also reports the lowest likelihood to be willing to take a class to manage their health condition. And classes have been something that both Public Health, OFA, and NERCL have provided now for over 10 years for individuals with chronic health conditions to help them learn how to effectively manage them. Because all of these, especially diabetes and even high blood pressure, can be very hard to manage with multiple medications, dietary changes, and lifestyle changes that would ultimately improve their health outcomes. Again, with healthcare access, we're meeting regular immunization schedule objectives. I will tell you that our immunization levels have dropped since 2020. We had traditionally been in the 80 percentile. Now we're down to 65.7. We do not do well with the specific HPV vaccination rates. We are working at a regional level to help address that. We also have low lead testing rates in our 1 and 2-year-olds. Again, we're working with our local providers to increase those lead testing rates. And we have a low number of children under 3 with an IFSP. And those are children receiving our early intervention services. So this could indicate that we're missing children who could benefit from the services. But again, we work with providers regularly to educate them about developmental screenings and making sure that they're making the appropriate referrals. Neighborhood and built environment. We have low physical activity levels among adults. Going down with the climate smart communities, Lewis County achieved bronze certification as a climate smart community in 2023. 28 action items were completed to achieve this. There are 120 total action items to take and 20 specific to community resilience, which the prevention agenda is specifically looking at. So we have some work to do here. Our complete streets work actually falls into this. And over the coming years, as these projects progress, we will undoubtedly see an improvement in not only health status, but also happiness of our residents. Under social and community, we have very high levels of mental distress and high suicide rates here in Lewis County. Lower than target long duration opioid prescriptions suggests we're making some good progress in responsible prescribing practices, which hopefully will further decrease the opioid epidemic. Again, under social and community, our high rates of smoking continue. Binge drinking is higher than the target of the state, however, on the decline. We have a high number of adults with childhood trauma. And for those of you that don't know, the abbreviation for adverse childhood experiences is ACEs. This is determined through an ACEs assessment, and we know childhood trauma increased the risks of chronic disease, mental illness, and substance abuse. You'll also see here we are doing poorly when it comes to child abuse cases, being higher than the state and the target. Some more,
Question.
Yep.
Your
want me to go
slide
back?
before that?
Yep.
Is the tobacco and e-cigarettes, vaping. Is that broken out at all?
Yep, I'm gonna go to it right
Okay.
now. So as far as the products that Lewis County is using, the community health survey indicates that we have a higher percentage of cigarette and chewing tobacco users and lower percent of nicotine pouch and vape users in comparison with the rest of the region. So that's just important to note and should inform us when we're going out and doing education. Not that we can leave vape and e-cigarette education out of it, because I think those are what's leading to the increased cigarette usage in adults. And the box on the right there shows you that as annual household income decreases, your likelihood of using nicotine increases. We're doing well with consuming fruit and vegetables, or at least meeting the objective. And we're also doing well with breastfeeding. This slide shows our growing older population. Does this have a, well, you can see to the right. Starting at age 60, the blue mark indicates, oh, did you do that? Okay. The blue line indicates that Lewis County is higher than the rest of the state for those populations. So this will show an increased demand for aging-related services, chronic disease management, and long-term care. To go along with our aging population, the Community Health Survey asked a question in regard to hours per week providing unpaid care to a loved one. Lewis County was the highest in the region. And the box on the right there shows you the challenges with having to provide unpaid care to a loved one. Again, stress and financial impacts. So, based on all of this data, and I realize I went through it quickly, but this data was presented to the Lewis County Priorities Council, which is a group of Health and Human Service Agency leaders. The entire assessment was provided to them, and these priorities were chosen and agreed upon, but I'm presenting this to you for your experience and expertise to weigh in on if there's anything that you feel we should add, we should take away. What kind of priorities do you feel are important? The sheet that I handed out to all of you, you'll see there's priority areas under each one of the domains. The domains are listed on the left, and all of the priority areas are listed there. Again, these were chosen not only on the data, but also on the Human Service Agency's lived experience and what we are currently struggling with here. So just to review them, it's housing stability and affordability, anxiety and stress, suicide, tobacco and e-cigarette use, and adverse childhood experiences. So next steps from here, obviously you guys have an opportunity to provide any kind of feedback. Next month, I would be coming back to you based on whatever kind of priorities you chose, with potential interventions that we would be working on for the next 6 years to address those priority areas. And this wouldn't necessarily be work that only public health is doing. We work with all of our community partners on these interventions. And I need to have the assessment and improvement plan to the state by the end of December. Any questions, suggestions?
I have a question.
Mhm.
Does our low population skew the numbers in such a way that we're not eligible or don't get a good enough share of the pie to help with some of these interventions that you're talking about?
I wouldn't say our low population contributes to us not getting funding. When we're looking at the data, a lot of them account for your population size. And I think if anything, the last few years, there's been a focus on rural health and trying to improve health outcomes, specifically in rural areas, and accounting for all of the challenges that come with being in a rural area versus the plethora of services that you get in an urban area. Our challenges are much different.
If you back up one slide, it looks to me like all of those areas of priority, the underlying issue is poverty. From the earlier slides that you had, like smoking, as income goes up, goes down, right?
Yep.
And that is probably true of most of those. Am I reading that correctly?
Yep. And like I said, the reason we didn't specifically choose poverty as a priority is because we're meeting the objective, number one. Number two, it is on the decline. So I did need to choose one of the priorities in the first box there. I believe it's under economic stability. So housing was chosen based on number one, us being the number one, us having the highest percentage reporting housing insecure in the region, and the continued struggles at the human service level in regard to housing is a struggle.
I was going to say, with poverty being that high and affordable housing, that creates a very large conflict to make it affordable for the poverty level. How do you go about funding something like that? I mean, that's right now we've been using a lot of grant money and state funds and federal funds.
Yep.
But the next few years look kind of
Yeah.
iffy as to what we're going to get to help us with this. Any suggestions or any ideas that you guys are knocking around?
So one of the things we were looking at, so everything that we can choose from must be an evidence-based intervention. So it has to have been proven to work in other areas. A land bank is one of the evidence-based interventions, which I think has been somewhat discussed here. So that could be something that helps in the housing situation. It's not necessarily getting a lot of funding and throwing it at a building. It's multiple things working together to improve the housing situation, which I think we've already done a lot of great things. We've done an assessment or a survey. I shouldn't say we, the planning department. So I think we have momentum moving forward that we could positively impact housing stability.
Any other questions? Thank you, Ashley.
Welcome.
So we will move on to the draft resolutions.
Okay, the first one is authorizing a renewal agreement with the Alcohol and Substance Abuse Council of Jefferson County DBA Pivot to develop and service an OASIS substance misuse prevention program at a cost not to exceed $314,902 per year from January 1st, 2026 through December 31st, 2026. This agreement shall include provisions for Pivot to pay a portion of the operational costs and expenses incurred by the county for maintenance, repairs, utilities, and other amenities of the building and grounds occupied by staff and clients at 7714 Number 3 Road, Lowell, New York location at a cost of $2,594 per month commencing on January 1st, 2026 through December 31st, 2030.
Any discussion? All in favor, say aye. Any opposed? Okay, resolution's moved.
Authorizing renewal agreements with Coordinated Care Services Incorporated, Rubenzall, Knutson and Associates, and Mental Health Association in Jefferson County for specific programs for a term of January 1st, 2026 through December 31st, 2026 with annual automatic renewals going forward.
Any discussion? All in favor, say aye. Any opposed? Okay, the draft resolution's moved.
Authorizing an amendment to the agreement with Coordinated Care Services to remit an additional payment of $4,600 for the additional 40 hours of time rendered from October 2025 through December 31st, 2025 for the professional specialized financial management services for fiscal officer support and required reports.
Any discussion? All in favor, say aye. Any opposed? So moved.
Authorizing an agreement and purchase of Motorola's Flex Plus subscription software suite and maintenance services for a 5-year period for the emergency communications system, including the CAD, RMS, and mobile data system software as outlined in its proposal dated August 1st, 2025. The 5-year term will commence on May 1st, 2026 through April 30th, 2031 with annual payments of $65,000.
Any discussion? All in favor, say aye. Any opposed? So moved.
Authorizing agreements with New York State Office of Children and Family Services for the purpose of providing federal funding to social services in the amount of $10,567.50 per quarter for an acceptable level of compliance and performance as specified by the Division of Child Care Services for registration and inspection of child care providers and Community Action Planning Council of Jefferson County for the purpose of conducting registration and inspection of family daycare and school-aged child care providers in Lewis County at an annual cost not to exceed $40,157.
Any discussion? All in favor, say aye. Any opposed? So moved.
Authorizing 6-month renewal agreement with ICU Security and Private Investigations for armed security guard services at the Human Services Building for a term of January 1st, 2026 through June 30th, 2026 at a cost not to exceed $50.71 per hour, all inclusive of taxes, insurance, disability benefits, and any other costs and expenses associated with providing said service 8:30 a.m. to 4:30 p.m. on the days DSS in the Human Services Building is open.
Any discussion?
Yeah. Question, can they be reports, if there's incidents up there, reports driven and action taken?
Yes, we'll make sure they do that.
And I will add, because we had discussion about this prior, that we did do kind of a spreadsheet to figure out what the most cost-effective manner was, and it was this version. Any other discussion? All in favor, say aye. Any opposed? So moved.
Authorizing agreements with various agencies for the provision of foster care services, emergency respite care, post-placement, and residential educational and treatment services for the term of January 1st, 2026 through December 31st, 2027 at a per diem cost not to exceed the maximum aid rate established by the state.
Any discussion? All in favor, say aye. Any opposed? So moved.
Authorizing renewal agreement with NERCL to provide facility amenities and staffing services for a warming center to overnight stays by the homeless for up to 12 hours, 7 days a week from November 1st, 2025 through 7:00 a.m. on April 1st, 2026 at a cost of $134,744.71.
Any discussion? All in favor, say aye. Any opposed? So moved.
The next three are the late drafts that were given to you. The first one is appointing Paige Wiley of Watertown, New York as a member of the Community Services Board Mental Health Subcommittee to fulfill the unexpired term of Ashley White.
Any discussion? All in favor, say aye. Any opposed? So moved.
Authorizing agreements with Milestones Children's Center, the Treehouse Hourly Childcare to provide services to the preschool special education program for children with special education and healthcare needs.
Any discussion? All in favor, say aye. Any opposed? So moved.
And then the last one is supporting Operation Greenlight in recognition of veterans, active military service members, and those in transition to civilian life from November 4th through November 11th.
Any discussion? All in favor, say aye. Any opposed? So moved. And we do not have any motions or a need for executive session, so I will make a motion for an adjournment. Do I have a second? Vinny? All in favor, say aye. Or, sorry, any discussion? All in favor, say aye. Any opposed? We are adjourned.
Call Finance and Rules Committee to order. Make a motion to approve the September 16th committee minutes if there are no changes. Do I get a second? Herb? All in favor, aye? Opposed? Minutes are approved. And next, we have a 2026 tentative budget presentation from our county manager, Tim Hunt. He assured me the other day that it was going to be accurate, precise, short, complete, and so on. And keeping it short. This is our initial review of it. We'll go from there.
All right, so this is our first look at the 2026 tentative budget. Obviously, a little overview of what we're going to talk about is the process, the transparency. Last year, we had some folks come in and talk to us about what we could do to make the budget more accessible to everyday folks in Lewis County. Some targets, drivers of the budget, what's driving it, our fund balance, revenue, expenses, and our tax rate and equalization rate, how it's going to impact different towns throughout the county. So obviously, the process today is October 21st, our budget workshop. We put in a lot of work to get to this point. The tentative budget will actually be presented to the legislators on November 4th. So between now and November 4th, we can get your input on any changes that may need to be made, and you will have a tentative budget presented at the legislative meeting on November 4th. So today we're going to start with some consensus building and some open discussion of where we're at and what we're doing. First thing I'd like to talk about is a little bit of the transparency. We did tape a podcast, Eric, Brian, and I, Caitlin, about how we put the budget together, meet with the department heads, put together the personnel budget, the capital budget. That is available on all your streaming services. It's available on our website, and that link right there will take you to it. So if anybody wants to learn more about the process, that is out there. The second thing is this right here. We've been working with Quantify Consultants, who is a Loudville-based consulting firm, to create dashboards that we can put on our website to report on our budget. This is an actual screenshot of a live. It's actually a blind link right now that's on our website. We plan to make it live once our budget goes live. This is 2025. It will show 2026. Year to date will start out at 0. Each month it will update, and people will be able to see what we approved and what's been spent. The bar graph there on the left, or the circle graph on the left, will be a breakdown of spending by department. And then the actual detail will be below that. So people will be able to look at our budget and say, okay, you're approving a spending plan of X amount of money. Where's that going? What are we doing with it? And so people will be able to get a better understanding of the budget. And then we also have a second page, which is payroll, which kind of shows everybody the breakdown of labor by department, by what is it made up of, straight labor, benefit time, overtime, etc. And then it's broken down by department so people can actually look to see what the labor calculations are. Once again, updating monthly, and that will be available on our website. I will do a presentation probably next month on specifically this. We'll bring up the actual dashboards, we'll drill into them, be able to answer some questions and talk a little bit. We want to make sure everybody has a primer on this. It's a lot of data, and it can create confusion if people have, the general public hasn't been exposed to it. So we're trying to get it out there and make sure that we're, being clear about what it is we're publishing and it's available. So our fiscal targets remain the same. Maintain a general fund balance between 10 and 30% of annual operations. Legislatively, that has been passed, and we have met that. Maintain a health system fund balance of at least 16% of annual operations. That has been maintained. Retain an A+ credit rating. Invest at least 3% of our annual operating budget into our capital equipment and projects, which we have done. And maintain a debt ratio of no greater than 50% of the constitutional limit, and we're well below that. So we've hit all those targets, and we'll talk a little bit about them in detail. Maintain a debt limit of no more than 50% of the constitutional limit. The 2008 courthouse bond was 5.4 million. And it matures in 2037. The building projects bond is 16.2 million and matures in 2042. Total debt currently is at $21,747,000. In New York State, the constitutional limit is how much debt a local government and school district can incur is based on the full valuation of taxable property, and it's 7% of the full value taxable valuation. Our full value is $3 billion times 7% means that we can borrow $235 million. If we include our debt of 21 million and the hospital's complete debt load of 51 million, we're still, as you can see, way below the constitutional limit. So we're in really good shape from that metric. Our fund balance summary. Our estimate at the end of this year of unallocated funds in the general fund, as you know, last year was $11 million. We're predicting that should be about 12.8 million at the end of this year. So we should see an increase in our general fund balance. County road, the estimate is 830,000. Highway machinery is a negative number, but that's due to some intercompany loans related to the leasing of equipment. Solid waste is at 230,000. These are all independent funds. We have a workers' compensation self-insured fund that sits at 3.8 million. Our health insurance fund, as you know, just got that infusion of cash from the shared services grant. So it sits at 2.5 million. And our capital fund sits at 4.2 million. So that's what we predict at the end of this fiscal year, our fund balances to look like. So fund balance target legislatively should be between 10 and 30% of our operating budget. This year's general fund operating budget is $71 million. Unallocated fund balance projection of 12.8 puts us at 18% of our operating budget. So right in the middle of that target. So we're in pretty good shape there. General fund balance. And I want to show a timeline here, a graph from 2018 to current. In 2024, we were starting to get very concerned with the fund balance sitting at $11 million. And we're projecting this to be at 12.8 at the end of this fiscal year. So we should see a little bit of improvement there. We do need to stay focused on that and make sure that our fund balance remains healthy, particularly as we go into some uncertain times with New York State and the federal government and changes to our Medicaid and Medicare programs. So we want to make sure we have the fund balance to adjust as needed. 2026 budget drivers on the income side, the assessed value of property in Lewis County grew at 6.5%. Sales tax increased by $550,000. There was a $200,000 reduction in the Flat Rock Wind pilot agreement. So that was a loss of revenue. And there was a $600,000 reduction in interest income from the treasurer's office. So, and that's primarily because we had that money sitting in from the building projects was earning interest, and now that's gone. So that is why you're seeing a reduction there. But so you're looking at a pretty significant decrease in income this specific year in that area. Expenses, as always, health insurance is double digits, retirement costs double digits, but our FTEs are down by 15, minimizing the impact of that and the labor costs. So and our fund balance health obviously is always a driver, but this year we really want to keep focusing on making sure we can improve that fund balance. The budget, general fund budget that we're going to propose is $71 million. County road, 9.1 million. County machinery, 956,000. Solid waste, 2.5 million, with a total budget of 83.695 million. The reason I'm presenting this, and in the past, I've only presented the general fund, that 71,000, is I want to start to talk about the budget a lot like the dashboards are going to show, because the dashboards are going to show general fund, county road, county machinery, solid waste, and it's going to show a budget of 83 million. So I want to make sure we're talking about the full budget, not just the general fund budget. And then the Lewis County General Hospital budget will be included in your packet, and that's an additional 112 million for a total budget of $195.7 million, the Lewis County budget. So revenue, 69 million in revenue. That is a $6 million increase over last year. Now, I'm going to explain where this money's coming from. It's not coming from our taxpayers. And we'll talk a little bit about that. We also had some revenue go up, so some things just passing through our budget. The overall revenue increase is 9.6%. Departmental non-tax revenue, which is just stuff that's coming from the state or federal government, grants, has gone up by $4.6 million. So $29 million total in non-departmental tax revenue. That's an 18.5% increase over 2025. Sales tax went up $550,000, as I mentioned, to 18.5 million. That's a 3.1% increase over 2025. And then what's left obviously goes to our taxpayers, and we're looking for $20,766,000. That is an $837,000 increase over the prior year. So really on a $6 million increase, less than about 800, obviously 837,000 is what's going to go to the local taxpayers. So here's our sales tax collection year over year. What we've budgeted and what we actually collected in 2024, we budgeted 17.7 million. We collected 18.5. This in 2025, we budgeted 17.9, and our collections are running above average. So we expect to surpass that, but we want to be careful because we're budgeting closer and closer to what we actually receive, and we want to start to be a little more conservative with that. Property values. Assessed value continues to grow in Lewis County. Total valuation is $3,364 million. That is an increase of $203 million from last year. Levied against that will be the $20,766,000. This is what full taxable value of property in Lewis County looks like year over year. You can see starting in 2023, we've had a pretty good upward climb every year. We expect that to level off. It has started to slow, but that is what it looks like as far as the taxable value. So the levy is a pretty easy calculation. We have a $71 million budget. We have 29 million coming in through the budget, federal, state, and grants. We have another 18.5 million in sales tax, and we're going to use 1.9 million of our fund balance, which is exactly the same amount we used last year. And that will leave us the levy of $20,766,000. This is a $837,000 increase, and that is what the levy looks like, the amount of money to be raised by our property taxes. So you can see from 2015 to 2026, a real steady, slow increase, which is expected with inflation running between 2 and 3%. Our tax rate, same calculation, except we take that levy amount, we divide it by the fully assessed value of $3 billion, divide it by 1,000, and that gives us a tax rate of $6.17 per $1,000 of assessed value. Last year, our tax rate was $6.31 per 1,000 of assessed value. So it's a 14-cent per 1,000 of assessed value decrease. It is a 2.09% decrease in the tax rate, and it keeps us under the property tax cap. So we will not be breaking the tax cap. There'll be no increase in the tax rate. This is a long look at 26 years of our tax rate. Back in 2000, it was $7.22 per 1,000 of assessed value. It is now currently $6.17. Some of that obviously is related to the increase in property values throughout that time. So let's look at how that's going to fall for individual towns and what that looks like. So this is each town, last year's taxable full value of assessment, the 2026 full value of assessment. And a couple ones that I want to point out is the town of Lowville's assessment has gone up 10.52%, but they did a townwide revaluation. And you're going to see what that does in a minute when we start talking about the tax rate. The other one that's of note is Osceola. Their taxable assessment went from 64 million to 75 million, almost $11 million jump. But that is because they haven't done an equalization in a long time, and their equalization rate dropped from 75% to 64%. So they're getting out of whack with the rest of the county. So you take that and you bring that in, Lewis County's tax rate is going down by 2%. And you can see how that plays out. So in Lowville, where they've just done a reval, that is going to reduce their tax rate by 7% in the town of Lowville. We have a number that town of Diana is 0%. It's exactly what it was the year before. So there'll be no change in the tax rate there. The largest increase actually is in the town of Osceola because of that equalization rate getting out of whack. So you can see, but very minimal impact throughout the county, especially where we're keeping our assessed values up to date. All right, so our budget total appropriation, $71 million. As I mentioned, about a 9.3% increase or $6 million increase. Our revenue is increasing by 5.2 million or a 12% increase. Balance raised by taxes is 22 million. We are going to use 1.9 million of fund balance, which is exactly what we used last year, so zero change there. Property tax levy has increased by $837,000, and our taxable value has increased by $203 million, and that is how we get the tax rate. So that's a table to show you kind of how we got there. So a little bit of the details of what's in here. As you guys heard in the personnel budget, we focused a lot this year on headcount and FTEs. So FTEs are full-time equivalents, people working 40 hours a week. And in 2025, we budgeted for 300 FTEs. In 2026, we have trimmed that by 15 people to 2085. All through attrition, people retiring, not replacing them, looking for efficiencies in the way we do that. As a result of that, we were able to reduce our payroll by $1 million in this budget, and that was huge, absolutely necessary. So the labor impact in this budget is $14,969 decrease from the year before. All funds, our labor is $18 million, $183,000 increase over last year. Health insurance, all funds, $5 million. That is a 3.1% decrease from last year. $158,000. And our retiree health insurance, all funds, $1.9 million, a 3% decrease or $59,000 decrease. And our retirement, all funds, $2.9 million, and that's a 0.7% increase over 2025 or a $19,383 increase. If you add all of those up, our total burden of labor for the county is $28 million, $677,000. But it gives you just a little idea. Obviously, we deliver services to the public, and it's people delivering services to people. So we're very, very heavy on the labor, and it's a very big impact on our budget. So this has been really focusing on that has made a huge difference. A couple other changes in the budget that I want to make you aware of. One of them is contingency. Last year, we had budgeted $300,000 in the contingency line. That remains the same. We also budgeted $300,000 in special legislative contingency, and we took that out because we've not used it. There's still $300,000 if throughout the year you as legislators say we'd like to engage in some project and we need some money. There's $300,000 available. I thought $600,000 was a little much, and so we trimmed that down a little bit. Budget changes with no tax impact. As I mentioned, the budget went up by $6 million. And I want to just show you a couple of those. We increased revenue from the hospital by $1.5 million, and we're going to increase the IGT expense by $1.5 million. We've been having some very productive conversations, very helpful conversations with the hospital. They're a great partner to kind of work through that. We both need to be healthy, the county and the hospital. And we're working through that right now. And we'll have a plan of exactly how that's going to show up and appear in our budget, with the idea of stabilizing our fund balance in the future. Bus operations in Fort Drum increased by $716,000, and we increased the expense line. So it's all just a pass through, but that's just two examples of how they flow through the budget. And that's why you see that $6 million increase, even though it's not really falling to the taxpayers. So just wanted to show you a couple that were just pass-throughs. Outside agencies, the non-departmental, just to kind of give you an update on that, we were able to meet everyone's previous commitments here. There's been a few minor changes. Cornell Cooperative Extension, there is an increase related to their labor costs. The other one on this page that I want to point out is the snowmobile clubs. Last year, we added an additional $9,000 to the snowmobile clubs, and we kept that in here again this year. And the other ones on this page were a $5,000 increase for the Lewis County Humane Society. From the prior year, it was not what they fully asked for, but it was more than what they've received in the past. Naturally Lewis was an increase as well, and Naturally Lewis and Cornell Cooperative Extension now receive the same amount of money as they have in the past, or as each other. Both of those agencies received $373,000. And I think that's about it. So the food pantries are also in here as we did last year. So those were the two new lines last year that we added in here. So capital transfers, Brian covered this in the capital budget, but I just want to reiterate the HAC, these are ones that we handle as capital projects. There are $285,000 in those this year that we'll talk about. Equipment, the capital reserve, HAL capital cleanup, and that is what we've been using for building demos and things like that. And HEV is the rail recreation fund that's been appropriated for the purchase of the railroads. So those are the funds that are there. In 2026, capital budget funding, the courthouse parking lot of $50,000, jail medical software of almost $50,000, data analytics dashboards, which we showed you a couple of them, but there's a lot more that we're going to show you. We'd like to kind of keep the momentum going on that. Bridge New York funds, these are not county taxpayer dollars, but these are what we plan on doing next year. Just to give you an idea, Pine Grove Road culvert at number 4 road, that's the one right by the corner corral, that will be replaced this next summer. Wood Battle Road should be replaced, that bridge, the big iron bridge over the Deer River. Marshy Road up in the town of Diana, that is scheduled to be replaced this year. And the Erie Canal Road Bridge for the town of New Bremen is scheduled to be replaced. And Bossert Road for the town of Lowville is scheduled to be replaced this year. Eatonville Road for the town of Gregg is scheduled to be replaced. And Cotel Road in the town of Watson. All of those are scheduled to be redone. And I did want to announce that we have had movement on the Bailey Road Bridge, and it does look like the state has come up with funding to replace that bridge as well. So I don't know if that will actually physically be done this summer, but we did find the funding, and it looks like it's going to move forward. CHIPS projects in paving, number 3 road from the village to Rice Road, Lee Road, towns of Martinsburg and Turin. And Complete Streets project, which is what we did in Glenfield, is scheduled to be Constableville this next summer. So that's a little bit of what's happening there. For 2026, I like to start setting the budget goals early, talking to the department heads about where we're going, what we have to do. I think we still need to focus on employment through attrition, another 5 to 8 additional FTEs, and I think we're going to be in pretty good place so that we can have an adjustment of wages and benefits and not overly strain our tax base. We need to eliminate 3 to 5 additional pieces of equipment. We want to keep focusing on making sure we have the right amount of equipment, and we're monitoring that pretty closely. Brian has implemented Samsara, which is a device that GPS locates all the vehicles, and we can see utilization rates and run really good reports to see how many pieces of equipment are sitting at any given time. We need to build that fund balance to absorb any unanticipated expenses. And so we're going to keep focusing on that. And we must always focus on growing revenue from other than our tax base. And the best way to do that is increase economic activity, sales tax, obviously. So in summary, slight decrease in the tax rate, the general fund balance, we need to keep focusing on, but we are going to see an increase in that. The levy will stay under the 2% tax cap, and that's where we're at. Any questions, comments, or feedback?
The sales tax increase of the
Yes.
550,000, is that due to short-term rentals?
No. Most of our good fortune in sales tax has been, I think it was 4 or 5 years ago, a law was passed where things that we buy off the internet, now we get to collect tax on that. So residents in Lewis County buying off of Amazon, those taxes are collected and remitted to us. That was a huge win for rural counties like Lewis County, because typically people would drive to Watertown or Syracuse to do their shopping, and they got to keep those sales tax. So we've seen a pretty good bump in the North Country because of that change in the law. The economy has also been, and we're watching this very closely, because the risk with sales tax is when the economy starts to tighten up, that can drop, and it can drop pretty quickly. We're watching it very closely. They break it down by sector. Building goods have always been pretty strong the last 3 or 4 years. And there are some counties that are starting to see decreases in sales tax. We're not one of them. Fortunately, we've seen a couple percentage points each and every quarter.
My compliments to Tim, Eric, and our department heads for coming up with what looks to me a very affordable budget. Thank you.
Thank you. And I really do have to give the credit. I mean, Eric's done a lot of work on this, but the department heads are really what makes this work, because they're the ones that do the hard work of coming in and sitting down with us. And we had a lot of fun. You know, a lot of departments came in with actual cuts this year, and they really heard the message that we're trying to tighten our belts and really manage the future here. And they did a great job. So I commend the department heads and all the employees too. We're asking a lot of them.
And I should also include the hospital for working with us and coming up with $1.5 million revenue for us. Really helped out a lot. So thank you, Jerry and Jeff.
Any other questions or comments at this time? I want to go along with what Larry said, that I know there's been a lot of work put into this, both from our internal departments and the hospital. It looks like a sound budget. It looks like we're on track to be in fairly good shape. And I commend Tim for presentation. It would have taken Ryan twice as long.
I can do more.
No, that's quite all right. And I guess since we don't have any questions or comments on that, we'll move to draft resolutions.
Okay, the first one is setting the public hearing for comments on the 2026 tentative Lewis County budget for the 18th day of November, 2025, to begin at 5:00 p.m.
Any questions or comments? All in favor, aye. Opposed? Carried.
Authorizing simultaneous lease agreements between Lewis County and BOCES with reciprocal purchase options for their respective properties, the Lewis County JCC Ed Center and BOCES BOAC Education Center, The lease and purchase option agreement for BOCES will be to pay to the county the sum of 1.3 million over a 10-year period, but with any outstanding balance of the 1.3 due at time of purchase and transfer of properties. And then there are additional details outlined in the resolution.
Any questions or
Yeah.
comments on that
I
one?
got a couple, Tom.
Okay.
By the next meeting, is it possible to get a survey map of what we're buying or what we're swapping so that we know exactly what properties are going to be the county's? Because it's my understanding, you said the 8 acres is going to be separate on the Maple Ridge site that we're still going to own. Is that correct? Okay, if we could have that mapped out as well as the BOCES Center and the JCC Center.
Sorry, do you want like official certified survey maps, or do you want?
Well, I believe in any real estate transaction is probably not a bad idea to have, so there's no questions about who owns what and where the lines are.
Okay.
I just think that's,
We have
But-
the surveys for the two properties, and I believe that we can get a draft of that 8 acres.
Yeah.
That has been surveyed. We just have to get that.
right, I'm
copy.
just including it in our packet so that we
Right.
can see it, because any
Mhm.
transaction that we do.
Yep.
Also, too, I have a question about the extending the lease for 2 10-year periods for a total of 20 years. What would that do with our annual payment? If we decide to go that way, what would that do with our annual payment from BOCES? Would it drop from 130 to something less? Or why are we extending it for a possibility of 30 years?
Because, well, the answer is no. They plan to pay it out over a 10-year period.
Right.
And after the 10-year period, we'd have to figure out moving forward if they were going to continue to lease it. The reason that we did those options is because BOCES cannot purchase this property until they go to their communities and get permission to do so. So they just wanted to have the option that if for whatever reason that doesn't happen, they can continue to invest in that property and move forward with a long-term plan.
Okay, it was my understanding though, with 130,000, if they were to go forward with it, that the 130,000 or 1.3 million, excuse me,
1.3 million.
that would be due at the final, would be due at after one 10-year extension, not 2, correct?
Correct.
Okay,
correct.
so
It,
we're all-
it could be due at year 2 if that's when they decide to purchase,
right,
but it would definitely be paid out by the end of 10 years because it'll be 1.3 million per year. And then at the end of 10 years, we would go in if they were to continue that, which that's not the anticipation. But then we would figure out what would be a fair market lease value for each of the properties without equity.
right. Well, I consider $1 a year lease fairly fair, you know.
Yeah.
Any other questions or comments? All in favor, aye? Opposed? Carried.
Authorizing a modification and extension agreement with Cornerstone to include provisions to provide Cornerstone with pre-closing possession of 5960 Main Street, Glenfield, New York, identified as tax map parcel number 259.04-04-08.100, and the full responsibility and obligation for costs and expenses of maintenance, repair, and/or replacement of any equipment, fixtures, systems, or structures upon execution of the modification agreement. In addition, the modification agreement will identify Cornerstone's agreement to enter into an easement for the placement of the public transportation system's bus shelter on the property along the road.
Any questions or comments? All in favor, aye? Opposed? Carried.
Setting a public hearing for December 2nd, 2025 at 5:00 PM to provide residents of Lewis County with the opportunity to offer any comments on the accomplishments of the current CDBG project number 636HR 300-23 Lewis County Housing Rehabilitation Program.
Any questions or comments? All in favor, aye? Opposed? Carried.
Awarding bid and authorizing contract with Labella Associates to complete the scope of work outlined in the comprehensive plan RFP at a cost not to exceed $215,275.
Any questions or comments? All in favor, aye? Opposed? Carried.
closing out capital account HAR, which is the capital building project, and the remaining funds of $396,601.05 will be reappropriated in capital account HAC, which is the capital buildings and grounds.
Questions or comments? All in favor, aye? Opposed? Carried. And that's all our resolutions. We don't have any motions. No need for an executive session. I'll make a motion that we adjourn. Have a second. Herb, all in favor? We are adjourned.